Great. All right, so we have a special video diary today. We have a beautiful 36 years old who's coming in because she has noticed that her eyes are just kind of beginning to hood down just a little bit. And she also felt that she was having a little bit of separation between the orbital area and her mid-face in the ways of the trough. You begin to see the trough when the mid-face begins to slide on down. And it's just a very early onset, but she wants to do something about it today. So we can do a little thread lifting. And she also felt that she was losing volume and in all the areas that used to make her look more youthful. So we're going to be revolumizing her and creating a little bit more dimensional effect to make her look younger. So we're going to be doing upper and lower eyelid. The eyelid because she has a little bit of fat coming out. So upper and lower eyelid, a little bit of threading and a little bit of fat revolumization. So we just did one of the four lids. We call this 4-lid surgery because there's upper, lower. We just got done with the lower lid, okay? And she'll eventually need, because the skin is so thin, we're gonna have to pinch up a little bit of skin. But already, from this view, you can see that she had that bulge from the fat, which was creating a pseudo trough here, in addition to the actual fact that she's got a little laxity creating a trough. But as you can see right here, that fat is gone, okay? So let's focus onto this picture, see if you can magnify it. I mean, we show this stuff all the time where we do in the middle of the surgery, and we compare left and right, but you can clearly see that she had a fat bag on the right side, fat bag on the left side. The left side is still there. Boom, the right side is gone, okay? And what you're seeing is a nice delineation of a natural muscle that's called a tarsal muscle roll right here. And when you look at a young person, that's exactly what they have. They have a muscle roll. So go ahead and smile, Eileen. So the muscle roll, and then there's a little bit of concavity. She does have that little bit of that crepey skin, so we're gonna have to, a lot of times when we have patients with decent skin texture, we can avoid having to pinch that skin up, even up to age 50, 55, but genetically she's got very fine skin here, so we're gonna go ahead and pinch that up, but that'll be done at the very end. We're gonna next to the left side, and we're gonna go ahead and we went and marked up everything we need to do in terms of how much skin we're gonna remove, so we're gonna go ahead to the left side, do this side, and then come back and go ahead and pinch that, okay? And that's most likely. We really appreciate you allowing us to do this, Very few patients allow for us to diary the whole process.
No.
I really thank you for this.
I thank you for making me beautiful.
Okay, so basically, we just got done with the right side. Go ahead and close your eyes. And that's the incision right there. There's a little bit of soaking of the blood, a little staining there, but open your eyes. That's our incision. So the mandate on Eileen's part was that if you got to really focus in really closely. There's an exposure of the fold, but after that, the fold gets completely hidden because of the hooding, the inevitable hooding that comes with aging. So she's been really trying hard to get a sense of lifting up of the eye, even using the aid of a makeup. That's what she's been doing, and she no longer wants to do that. So the mandate was that the fold should be exposed here, but she wants more of the fold exposed going out laterally, because that's how we used to look when we were young, and that's exactly what we did. If the previous picture shows that there was just a showing of the fold just in we call this the medial aspect, we call this the lateral aspect. If the exposure was just in the medial, maybe 1/4, and everything else is hooded, now it's just the opposite. There's some showing, good showing of the fold here, but much greater sense of a fold showing here. So therefore less sense of hooding, and that's exactly. So I don't think you need to put on that makeup anymore.
I don't think so.
Okay, the hockey stick, no more. All right.
No, I was trying to lift it. No, you know why? Yeah. Because it was almost like a full-on turn.
Yeah.
It's like extra fabric.
Yeah. So then later on, we're gonna show, but we're gonna even give you a little bit of brow lift and make that a bit more exposed, a little more lifted, if you will. Okay.
Great.
A little lateral brow lift.
Yeah. I mean, it's a beautiful curvature that you gave it.
Yeah.
I think it's great.
So we're gonna go ahead and do the left side. The filling in with a little bit of lidocaine, the anesthetic, is making this fold show a little bit more, but we really haven't done anything to it yet. So we're gonna go ahead and do that. And then, so we're all getting a little worn out, and definitely eyelid is getting worn out too. Keep in mind that this is a picture of our beautiful patient with makeup on and everything. Just focus onto the eye. As you can see, there's significant hooding at the time before the surgery. Now we've sculpted her upper eye so that the eyelid fold shows a lot more and that the hooding is much improved. There's a little more swelling here, but once the swelling goes down, I think the degree of the fold show and the less hooding will kind of be equal on both sides. Having said that, we have to look at the eye and see that one eye is slightly different from the other eye. In other words, the left eye is definitely lower than the upper eye. So taking that into consideration, I think we'll achieve pretty good symmetry once all the swelling goes down. Okay. So now we had mentioned that after we did the fat earlier, that at the last part of the eyelid surgery would be to pinch out the skin. We were able to do quite a bit of pinching of the skin, so everything has become flatter, and she's definitely less crepey here. And later on, this is a marking for the thread that we're going to be doing. We're going to provide a little bit of facelift and a little bit of brow lift on both sides, and we'll show you that. We'll show that as the part 6. And after that, we're going to fill in the trough area with a little bit of fat and a little bit of fat to her temple area, as well as maybe give a little bit of fat to the cheeks and provide her with revolumization. Okay, that's good.